Terminology. Term. Meaning. Apprenticeship. Learning by doing. Interventions. Actions taken to improve, maintain, or restore health. Invasive procedures. Procedures that require entry into the body. Aseptically. Without introducing infectious material. Nursing theory. A statement about relationships among concepts or facts based on existing information. Nursing process. An organized, deliberate, systematic way to deliver nursing care. Implement. Put into action. Primary nursing. In this system, one nurse plans and directs care for a patient over a 24-hour period. Total patient care. One nurse carried out all nursing functions for the patient, including medication administration. Team nursing. An RN is the team leader who coordinates care for a group of patients. Disease. A pathologic process that causes illness. Health. A state of optimal physical, mental, and social well-being. Chronic illness. Persisting for a long time. Acute illness. One that develops suddenly and resolves in a short time. Terminal illness. One for which no cure is available. It ends in death. Primary illness. One that develops without being caused by another health problem. Secondary illness. Caused by a primary illness. Congenital illness. Present at birth. Illness behaviors. How people monitor the body, define and interpret symptoms, seek health care, and follow advice. Wellness. Physical and mental well-being. Transition state. Illness may consist of vague, nonspecific symptoms. Acceptance stage. Once the person stops denying illness and assumes a sick role. Convalescence stage. Process of recovering after the illness. Cop or coping. Adjusting to or accepting challenges. Asymptomatic. Without symptoms. Symptomatic. Having symptoms. Health literacy. Knowledge and skill making healthcare decisions. Holistic. An approach to caring for the sick and promoting wellness. Stasis. A static or balanced state. Homeostasis. A tendency of biological systems toward stability of the internal environment by continuously adjusting to survive. Stress. Disturbs the organism's homeostasis and causes the body to attempt to adapt. Stressor. Adverse stimulus. Autonomic. Not subject to voluntary control. Defense mechanism. Strategies that protect us from increasing anxiety. Adaptation. To adapt is to respond to change. General adaptation syndrome, GAS. The body attempts to deal with stressors by secretion of hormones that cause adaptive responses. Local adaptation syndrome, LOS. It takes place within a single organ or area of the body, such as when a cut finger becomes inflamed. Primary prevention. Avoids or delays the occurrence of a specific disease or disorder. Secondary prevention. Screening for diseases that easily treated. Tertiary prevention. Recover or rehabilitation measures after the disease is stabilized. Repression. Unconscious blocking of a wish or desire from conscious awareness. Denial. Escaping unpleasant, anxiety-causing thoughts by refusing to acknowledge their existence. Projection. Attributing an unconscious impulse, attitude, or behavior. Regression. Returning to an earlier level of adaptation when severely threatened. Rationalization. Falsifying an experience to justify an unpleasant experience. Displacement. Discharging intense feelings for one person onto another person who is less threatening. Identification. Modeling behavior after someone else. Sublimation. Rechanneling an impulse into more socially desirable object. Scientific method. A step-by-step process used by scientists to solve problems. Outcomes. Results of actions. Assessment. Data collection. Carried out in an organized, systematic way to determine and eliminate potential health problems. Analysis. Analyzing cues, identifying problem areas, and forming hypotheses of data collected during assessment. Planning. It involves generating solutions by determining specific interventions and desired outcomes. Implementation. It is the process of taking action by preparing and performing the interventions. Evaluation. It is the process of evaluating outcomes, whether expected outcomes have been achieved or not. Subjective data. Data obtained from the patient verbally that only the patient can describe or verify. Objective data. Data that are seen, heard, measured, or felt by the person carrying out the assessment. Microorganisms. Organisms only visible with a microscope. Pathogens. Microorganisms capable of causing disease. Normal flora. Non-pathogenic organisms that are prevalent on and in the body. Bacteria. Single-cell microorganisms lacking a nucleus. Antibiotic. A chemical substance that can kill or alter the growth of bacteria. Antimicrobial. Killing or suppressing the growth of microorganisms. Prion. Protein particles that lack nucleic acids. Protozoa. One-celled microscopic organisms belonging to the animal kingdom. Viruses. Extremely small and composed of particles of nucleic acids, either DNA or RNA. Rickettsia. Small or rod-shaped microorganisms that transmitted by the bites of lice, ticks, fleas. Fungi. Tiny, primitive organisms that contain no chlorophyll. Helminths. Parasitic worms or flukes. Contaminated. Unclean. Aseptic. Free of microorganisms. Sterile. Free from all microorganisms. Sterilization. Process of removal of all organisms. Phagocytosis. Destruction by white blood cells. Comorbidities. More than one illness or disease at the same time. Debris. Dead tissue or foreign matter. Interferon. An action which interferes in the replication of many viruses. Immune response. The body's reaction to substances interpreted as oneself. Asepsis. A practice of making the environment and objects free of microorganisms. Medical asepsis. A practice of reducing the number of organisms present or reducing the risk of transmission of organisms. Surgical asepsis. A practice of preparing and handling materials in a way that prevents the patient's exposure to living microorganisms. Disinfectants. Solutions containing chemical compounds such as phenol, alcohol. Antiseptic. A chemical compound that is used on skin or tissue to inhibit the growth/elimination of microorganisms. Leukocytes. White blood cells. Leukocytosis. Increased white blood cells. HIs. Healthcare-associated infections. Bone. A dense, hard type of connective tissues. Joint. A place of union of two or more bones in the body. Bursae. Small fluid-filled sacs that provide a cushion at friction points. Skeletal muscles. Striated muscles that are made of bundles of muscle fibers. Tendons. Cords of fibrous connective tissue connect a muscle to a bone. Ligaments. Connect bones or cartilage to provide support and strength. Pressure injuries. Tissue injuries that form from lack interference with circulation. Contractures. Resistance to stretch in damaged muscle that pulls a joint into a fixed or frozen position. Shearing force. Occurs when a patient slides down in a chair or slid up to the head of the bed without lifting the body. Symmetry. Equality in size, form, and arrangement. Gait. Style of walking. Supine position. Lying down on the back and face up. Prone position. Lying face down. Fowler's position. By elevating the head of the bed 60 to 90 degrees. Semi-Fowler's position. Elevation of 30 to 45 degree. Log rolling. Turning the patient as a single unit while always maintaining straight body alignment. Dangling. Patient position of sitting on the side of the bed with the legs and feet over the side. Integumentary system. A system that contains the skin, hair, nails, and sweat and sebaceous glands. Epidermis. Outer, thinner layer of skin. Dermis. Inner, thicker layer of skin. Sebaceous glands. Secrete an oily substance. Sebum. An oily substance secreted by the sebaceous glands. Melanin. The main determinant of skin color. Incontinent. Lost bowel or bladder control. Maceration. Softening of tissue. Diaphoresis. Perspiration or excessive sweating. Stage 1. Pressure injury. Intact skin that is red, deep pink, or mottled skin. Stage 2. Pressure injury. Partial thickness skin loss that exposed dermis. Stage 3. Pressure injury. Full thickness skin loss that looks like a deep crater. Stage 4. Pressure injury. Full thickness skin loss with extensive tissue necrosis or damage. Unstitchable pressure injury. Loss of full thickness of tissues. Deep tissue pressure injury. Intact skin that is maroon or purple or a blood-filled blister. Eschar. A type of thick, black, or brown dead tissue that forms over a wound. Necrosis. The permanent death of cells or living tissue. Pass. Pull the pin. Aim at the base of the fire. Squeeze the trigger. Sweep side to side. Race. Rescue any patient. Activate the fire alarm system. Contain the fire. Extinguish the flames or evacuate. OSHA. Occupational Safety and Health Administration. Biohazard. A biological agent, chemical, or condition that can be harmful to a person's health. Poison. A substance that may cause functional or structural disturbances. Vital signs. Temperature, pulse, respiration, blood pressure, and pain level. Fever. Elevated temperature. Pyrogens. Agents that cause fever. Basal metabolic rate, BMR. A rate at which heat is produced when the body is at rest. Stroke volume. The volume of blood pushed into the aorta with each heartbeat. Cardiac output. Pulse rate multiplied by the stroke volume. Respiration. Exchange of oxygen and carbon dioxide in the lungs and tissues. Hypoxia. State of insufficient oxygen. Systolic pressure. Maximum pressure exerted on the artery during left ventricular contraction, systole. Diastolic pressure. Lower pressure exerted on the artery when the heart is at rest between contractions, diastole. Overhydration. Excessive fluid volume. Tympanic membrane. Eardrum. Axilla, axillary. Armpit. Core temperature. Temperature of the deep tissues of the body. Onset fever stage. Occurs gradually or suddenly. Febrile stage. The body temperature rises to the new set point. Defervescence stage. Abatement of fever. Hypothermia. Subnormal or low body temperature. Constant temperature. Temperature is continuously elevated with less than 1F. Intermittent temperature. Temperature alternates rising and falling. Remittent temperature. A high temperature fall. Relapsing. Temperature falls to normal and then rises again in a repeating pattern. Palpate. Feel. Tachycardia. Pulse greater than 100 beats per minute, BPM. Bradycardia. Pulse less than 60 BPM. Pulse deficit. Difference between the apical and radial pulse. Arrhythmia. Irregular pulse. Normal pulse range. 60 to 100. Athlete's pulse range. 45 to 60. Adult male. 72. Adult female. 76 to 80. Child 5 years. 95. Child 1 year. 110. Newborn. 120 to 160. 1 plus pulse. Weak and regular. 2 plus pulse. Strong and regular. 3 plus pulse. Full and bounding. Feeble. Barely palpable. Thready pulse. Weak and maybe irregular. Absent pulse. No pulse palpable or heard on auscultation. Normal respiration. 12 to 20. Older adult respiration. 16 to 20. Healthy adult respiration. 12 to 20. Adolescent respiration. 16 to 20. Child 3 years. 20 to 30. Infant 1 year. 20 to 40. Newborn. 30 to 80. Eupnea. A normal, relaxed breathing pattern. Dyspnea. Difficult and labored breathing. Tachypnea. Increased or rapid breathing. Bradypnea. Slow and shallow breathing. Hypoxemia. Decreased levels of oxygen in the blood. Hyperventilation. A pattern of breathing in which there is an increase in the rate and depth of breaths and CO2 to fall. Kussmaul respiration. Increased rate and depth with panting and long, grunting exhalation. Biot respiration. 4 or 5 breaths of equal depth. Apnea. Absence of breathing. Cheyne-Stokes respiration. A pattern of dyspnea followed by a short period of apnea. Crackles. Abnormal, non-musical sound heard of auscultation. Gurgles. Low-pitched wheezes. Stertor. Snoring sound produced when patients are unable to cough. Stridor. Crowing sound on inspiration caused by obstruction of the upper air passage. Wheeze. Whistling sound. Oximetry. Measurement of oxygen. Oximeter. A machine that measures oxygen in the blood. Auscultation. Hearing the sounds made in the artery by the beats of the heart. Pulse pressure. Difference between systolic and diastolic blood pressure. Normal BP. 120/80. Elevated BP. 120 to 129/80. Stage 1 HTN. 130 to 139/80 to 89. Stage 2 HTN. 140 or higher/90 or higher. HTN crisis. Higher than 180/90 or higher. Choric cough sounds. Sounds that relate to the effect of the BP cuff on the arterial wall. Auscultatory gap. No sound. Hypertension. High BP or 130 systolic and or 80 diastolic. Hypotension. Low BP. Orthostatic hypotension. Drop in BP when arising to a standing position. Shock. Circulator collapse. Integument. Skin. Necrosis. Death or injury to cells. Platete aggregation. Clumping. Fibrin. A protein essential to clotting. Hemostasis. Blood clotting or vessel compression. Phagocytosis. Engulfing of microorganisms or foreign particles. Erythema. Redness. macrophages, phagocytic monocytes, collagen, fibrous structural protein of all connective tissue, draining wounds, yellowish, non-draining wounds, dry, infected/inflamed wounds, reddish, necrotic wounds, black. Thank you very much for watching.